All right, let's dive into the world of daptomycin today. We've got two great sources, the official prescribing information and a presentation by Dr. Khalid M. Hassan.
Dr. Hassan's work is fantastic.
Absolutely. Big thanks to him for putting that together. Our mission, not just learning what daptomycin is, but, why it matters in medicine.
Exactly. The why is key.
The prescribing info can get kind of technical, but
Yeah, it can.
let's break it down. First off, what is daptomycin?
Well, the prescribing information describes it as a lipopeptide antibacterial, basically meaning it's derived from a specific type of bacteria, Streptomyces roseosporus.
Oh, wow.
Yeah, it's super interesting how scientists use nature to create, such powerful medicines.
So we're fighting bacteria with bacteria.
Yeah, kind of. It's really fascinating.
And how is daptomycin given?
Well, no easy pill for this one. It's actually a powder that you have to mix with saline solution, and it has to be given intravenously.
Okay, so no pill popping for daptomycin.
Not this time.
It's serious business. What kind of infections does it treat?
It's great against infections from what we call gram-positive bacteria. Two big ones where it shines are complicated skin and skin structure infections. We call them CSSI for short.
Okay.
And then Staphylococcus aureus bloodstream infections, also known as bacteremia.
Wow, those sound pretty intense.
They can be, yeah. And it can even tackle the ones that affect the heart, like right-sided infective endocarditis.
Oh, wow.
Yeah, especially when you're dealing with MRSA, which is methicillin-resistant Staphylococcus aureus.
Oh, right, the superbug.
Yeah, exactly. So having daptomycin is really, really crucial.
Like our secret weapon. But there's a note, daptomycin isn't tea for pneumonia.
Right.
Why is that?
It all comes down to how daptomycin works. You see, it attacks the bacteria's cell membrane, disrupts it, and ultimately kills the bacteria. But in our lungs, we have this substance called pulmonary surfactant, and it actually interferes with daptomycin reaching those cells.
So it's location specific.
Exactly.
Interesting. What about the dosage? How much? How often?
Usually once a day, but the exact amount, well, that depends on how well your kidneys are doing.
Ah, I see. The prescribing information mentions a table with dosages based on creatinine clearance, CLCR.
Right. CLCR, or creatinine clearance, is essentially a measure of how well your kidneys are filtering waste from your blood.
Okay.
And since daptomycin is mostly cleared by the kidneys, if they're not working well, the drug could build up and cause problems.
So doctors have to adjust the dosage based on someone's kidney function.
Absolutely. It's super important.
Is there a limit on how long someone can be on daptomycin?
Yes, there are recommendations on the maximum treatment length. Depends on the infection, For CSSI, it's usually 7 to 14 days. But for Staphylococcus aureus bloodstream infections, you're looking at possibly 2 to 6 weeks, maybe even longer.
So it's tailored to the infection. Now, the question on everyone's mind, side effects.
Right. Well, like ANY medication, daptomycin can have some...
Gotta be careful.
Always. Some common ones are digestive issues like diarrhea. You might get some headaches, dizziness, maybe a rash.
Those don't sound too bad.
Usually they're pretty mild. But there are a few more serious ones, though they're less common. The big three are anaphylaxis, or hypersensitivity reactions, basically, serious allergic reactions. Then you have myopathy and rhabdomyolysis.
Those are
muscle problems.
muscle problems, right?
Yeah. Muscle pain, weakness, could even lead to kidney damage. And then there's eosinophilic pneumonia,
Okay.
which is a type of lung inflammation.
Those sound pretty concerning.
They can be serious for sure, but doctors monitor patients really closely for any of these.
That's good to know.
It's always best to contact your doctor right away if you feel anything unusual while you're taking daptomycin.
Right. Always better safe than sorry. Okay, let's talk about daptomycin and other medications. Any big no-nos?
That's a really good question. It can interact with other medications and even lab tests, which is fascinating.
Oh, that's interesting.
For example, there's HMG-CoA reductase inhibitors, or statins. Those are for lowering cholesterol. Combining them with daptomycin can increase the risk of those muscle problems we talked about.
Oh, so that's a combo to avoid.
Yes, definitely something to be aware of. Now, interestingly enough, it doesn't seem to be affected by probenecid, used for gout, or warfarin, the blood thinner.
Huh, that's surprising.
Yeah, but there's one interaction that's particularly interesting.
Okay, lay it on me.
Daptomycin can actually mess with a common blood test, the PTNR. That's the one that measures how long it takes for your blood to clot.
Wait, seriously?
Yeah. It seems to interact with some of the components in the test, giving a falsely prolonged clotting time.
So it's not that the blood is actually clotting slower, just the test is off.
Exactly. But doctors know about this, so they can adjust by timing the test right or using a different method if they need to.
It's amazing how complex these interactions can get.
Absolutely.
But the big question, does it actually work against those tough infections?
We got to look at the clinical trials, It's where the science comes alive.
Let's get into it then.
So for CSSSI, it's about as effective as vancomycin or some penicillins.
Okay.
And for Staphylococcus aureus bacteremia, it's also comparable to those standard treatments, vancomycin or penicillins again.
So not a miracle cure, but it's up there with the other options.
Right. The one thing to note, the studies did show it might be a bit less effective for folks with moderate kidney problems.
That makes sense, considering how important those kidneys are for this drug.
Exactly.
Is there any way to know for sure how well it'll work for a specific person?
The prescribing information actually has tables showing success rates for different infections. It's something to discuss with your doctor, to get a sense of the potential outcomes.
Right. It's a powerful tool in the fight against bacterial infections, especially with all this antibiotic resistance happening.
It definitely is. It's a great option for people who can't tolerate other antibiotics, too.
All right, so we've talked about what it is, how it works, what it's used for, but can you connect the dots? Why is daptomycin important in the big picture?
It's huge GE in the fight against resistant bacteria, especially MRSA. It can literally be life-saving for some patients, and it gives doctors more options for treating these tricky infections.
But are there any downsides to relying on it so much, in the long run?
That's a great point. It really highlights how crucial it is to use daptomycin responsibly, just like any antibiotic. We don't want even more resistance popping up.
That's a scary thought. So daptomycin, powerful tool, not a cure-all. We got to understand it, use it carefully. But how exactly does it work? What makes its mechanism of action unique?
That's a fantastic question. Daptomycin's mechanism of action is really unlike many other antibiotics out there.
I'm intrigued.
It's really cool. Think of a bacterial cell, right? Like a little fortress. And it's got this protective outer wall, which is the cell membrane.
Okay.
Daptomycin, what it does is it binds to that membrane, and it basically punches holes in it.
So it's like a molecular siege weapon.
Exactly. And once those holes are punched, well, the cell can't keep its balance anymore. It's like the fortress starts leaking and everything falls apart.
That sounds super effective.
Yeah.
So because it works so differently, it can target bacteria that have, become resistant to those other antibiotics.
That's the key. They may have found ways to block or avoid those other drugs, but daptomycin comes in with a whole new strategy.
Outsmarts them.
Exactly. That's why it's so valuable in this fight against resistance.
But if it's so good against resistant bacteria, why not use it for all bacterial infections?
That's a great question. Dr. Hassan actually talks about this in his presentation. As great as it is, it's not a cure-all. There are a few reasons it's not used more widely.
Okay, I'm curious.
Well, first off, like we talked about, it only works against those gram-positive bacteria, the ones with that tough outer membrane. It can't touch gram-negative bacteria. They've got a different structure.
So it's specialized, not like a general antibiotic.
Right. And second, got to remember those side effects. Usually they're mild, but there's always that chance of something more serious.
All right, got to weigh the benefits with the risks.
Exactly. And then there's the cost. Daptomycin, it's not cheap compared to some other antibiotics.
Cost is always a factor, unfortunately.
It is. So, yeah, it's not always the most practical choice. When doctors are deciding whether to use daptomycin, they kind of think about all these things.
There's a lot to consider when it comes to antibiotics.
Oh, absolutely. Lots of nuance. That's why understanding the pharmacology, the mechanism, the side effects, the interactions, it's so important.
Got to have that knowledge.
Yeah, especially with antibiotics, you're talking about life or death situations.
That's powerful.
Oh.
Okay, so we've got the what, the how, the why. We've talked about the challenges and things to think about. Now let's get into some specifics of daptomycin therapy based on what Dr. Hassan lays out.
Sounds good.
Let's start with dosage. We touched on it before, but can you give us a bit more detail?
Sure. So it's given once a day, and the dose, well, that depends on how those kidneys are functioning.
And that's where the CLCR comes in.
Right. The prescribing information has a whole table showing the right dosage based on creatinine clearance, that kidney function measure.
Right. So lower CLCR, worse kidney function, lower the daptomycin dose needs to be.
You got it. Getting the dose right is key. Make sure it's effective, but also minimize the risk of those side effects.
Makes sense. How's it actually given?
Intravenously, either a quick injection over 2 minutes or an infusion over 30 minutes.
Okay, so no pills. Got to go straight into the bloodstream.
What about the length of treatment?
That depends really on what kind of infection we're fighting.
Right. CSSSI versus bloodstream infections.
Yeah, so those complicated skin infections, usually it's 7 to 14 days. But for Staphylococcus aureus in the blood, could be a lot longer, sometimes up to 2 to 6 weeks.
Really got to stick to the doctor's orders, finish the whole course.
Oh, absolutely. Even if you start feeling better early. Stopping too soon, well, the infection could come back, and it might be resistant to the antibiotics. Makes sense. Got to take antibiotic therapy seriously. All right, we've got dosage, how it's given, length of treatment. Let's move on to the side effects. I know everyone wants to know, but not everyone who takes daptomycin actually has side effects.
Very true. And when they happen, a lot of times they're mild, don't last long.
But good to be aware of them.
Definitely. So let's go through some of the common ones, and then we can touch on the more serious ones, even though they're less common.
Okay, sounds good. What are some people might experience?
Diarrhea, that's pretty common with daptomycin, like a lot of antibiotics. It's usually not too bad, goes away on its own.
But if it's bad or it doesn't go away, got to talk to the doctor, right?
Yeah, could be something more serious. Headaches and dizziness, those are common too. And skin problems, maybe a rash.
I remember reading that it can affect liver function tests and that muscle enzyme CPK.
You're right. Doctors will keep an eye on those levels, make sure everything's okay.
Okay, so those are the common ones. What about the more serious side effects?
One of the most serious is anaphylaxis. That's a severe allergic reaction, and it can be life-threatening.
That's scary.
Yeah.
What are the signs, and what should someone do if they think they're having it?
If you have any trouble breathing, any swelling of the face or throat, or if your heart starts racing, get medical help immediately.
Got it. Any other serious ones?
Myopathy and rhabdomyolysis are also a concern.
The muscle problems.
Exactly. Muscle pain, weakness, could even lead to kidney problems. Tell your doctor right away about any unusual muscle symptoms.
So anything feels off, call the doctor.
Absolutely. And lastly, it can cause eosinophilic pneumonia. That's a type of lung inflammation, fever, trouble breathing, and they might see something called lung infiltrates on an X-ray.
Okay, so a lot of potential side effects to keep in mind.
Yeah, but it's really important to remember that most people don't get these serious side effects, and doctors are trained to watch out for any problems.
Good to remember. We need to know the risks, but no need to panic. Now I want to talk about something Dr. Hassan focuses on. Antibiotic resistance. Huge. We can't ignore it.
It's a growing problem, all over the world. It's making it harder and harder to treat bacterial infections effectively.
When bacteria become resistant, what does that actually mean?
The drugs don't kill them anymore. Longer illnesses, more complications, even death. It's a serious public health issue.
So what causes it?
Several things. One of the biggest is just using antibiotics too much, or using them the wrong way.
Overuse and misuse.
Exactly. Sometimes antibiotics are given for things they shouldn't be used for, like viral infections.
Right. Antibiotics only work on bacteria, not viruses.
Yep. So taking them for a virus won't help you, might actually hurt because it exposes the bacteria to the drug for no reason, gives them a chance to develop resistance.
Like teaching them how to dodge the antibiotic.
That's a good way to think about it. And then there's not finishing the whole course of treatment.
We talked about that with daptomycin.
Right. Stop taking it early. You might not kill all the bacteria, and the ones left behind, more likely to become resistant.
Tough survivors.
You got it. Take the whole course, as your doctor tells you, even if you feel better before you're done. And then there's the use of antibiotics in farming.
I hadn't thought of that one. What happens there?
They use them a lot in livestock to make them grow faster and to prevent disease. But that can create resistant bacteria in the animals, and those can spread to humans.
So many pieces to this puzzle.
It's complicated, for sure. Solving it will take a lot of different approaches.
So, given all that, what can we do about antibiotic resistance?
We all have a part to play. First, make sure antibiotics are only used when they're really needed. No more giving them for viral infections. And people need to understand, finish the whole course of treatment, even if you feel better.
Good points. What about the farming part?
Cutting back on antibiotics in agriculture, that's super important. And we need to invest in research, find new antibiotics that can take on these resistant bacteria. We're running out of effective drugs.
We need new weapons.
Absolutely. It's a race against time. Got to act now to protect antibiotics for the future.
And that brings us back to daptomycin.
How so?
It's one of the drugs that is helping fight resistance, right? It's effective against a lot of those resistant bacteria, like MRSA.
You're right. And that's why it's so important to understand how to use it wisely.
Not wasting this weapon.
Exactly. Okay, so we've talked a lot today. what daptomycin is, how it works, those side effects, and why it's so important to be careful with antibiotics.
This has been really interesting.
It's a fascinating topic.
I feel like I've learned so much. I hope our listeners are enjoying it too.
I'm sure they are.
One last thing Dr. Hassan mentions, the importance of research.
Keep learning.
Yes. We need to study daptomycin more, learn about its effectiveness, its safety, and what its potential for resistance is.
So important.
And we got to find new antibiotics that can handle resistant bacteria. It's a constant battle, but we're in it to win it.
We are. Well said.
I think it's time to wrap up this part of our deep dive. But before we go, huge thanks to Dr. Khaled M. Hassan for all this information.
Yes, thank you, Dr. Hassan.
And to you, our listener, thanks for joining us. We hope you've enjoyed learning about daptomycin with us.
Keep learning about this antibiotic and about antibiotic resistance. It's something that affects all of us.
We'll be back soon to keep exploring daptomycin. Until then, stay curious.
Welcome back to our deep dive on daptomycin. You know, in Dr. Hassan's presentation, he talks about all this research happening looking at new ways to use daptomycin.
Oh, yeah. Like what?
Well, one thing is using it with other antibiotics.
Oh, interesting.
Yeah. So not just daptomycin alone, but like as a team.
So looking for synergy, you mean?
Exactly. Like,
Yeah.
can combining it with other antibiotics make it work even better against certain bacteria?
I see, trying to boost its power.
Right. And some early studies are showing, yeah, this could be really promising.
Makes sense. Hit them with a double whammy.
Huh, yeah. And it might even help overcome some of those resistance mechanisms.
That's great. Are they only looking at combining it with other antibiotics, or are there other things being explored? It's not just other antibiotics. Some trials are even looking at using daptomycin alongside other therapies like surgery.
Ah, okay. I can see how that would be helpful.
Right, especially for infections in, implanted devices or those deep abscesses.
Yeah, where you need to physically remove the source of the infection.
Right. Surgery gets rid of the source, and then daptomycin can mop up any bacteria hanging around.
Teamwork. It really shows how important it is to have lots of different approaches to treat these tough infections.
Totally. Now, another area of research that I thought was really interesting is they're looking at new ways to give daptomycin.
Oh, how so?
Well, remember, right now it's only available intravenously.
Right, that can be tough for some patients.
Exactly. It's not easy to do in like outpatient settings or if
Yeah.
you don't have a lot of resources. So researchers are trying to make it easier to give.
I see. So what are they thinking?
Well, get this. They're working on an inhaled form of daptomycin.
Wow, inhaled. That's amazing. What would that do?
I know, right? It could be huge, especially for those lung infections.
Ah, because remember we talked about how the intravenous doesn't work well for pneumonia.
Right, because of that pulmonary surfactant stuff.
Exactly.
So if you deliver it straight to the lungs, you bypass that problem.
So smart. They're solving the problem by changing how it's given.
And it's not just pneumonia. It could help with other respiratory infections too, like MRSA in the lungs.
That's incredible. This research could really change how we treat bacterial infections.
I agree. It's really exciting stuff. It's so cool to see how daptomycin research is, moving forward.
I bet Dr. Hassan is thrilled with all these new developments too.
Oh, for sure. His passion for this drug and its potential just shines through in his work.
Okay, so we've really explored daptomycin inside and out. From how it works to how it's fighting antibiotic resistance, even what the future might hold.
Yeah, we really went deep.
And we hope you, our listener, learned a lot too. But before we wrap up, one last thought.
I'm listening.
Daptomycin is a powerful drug. It can save lives. But it's also a reminder, right? We have to use antibiotics carefully.
Yes, absolutely. And we need to keep supporting the research, finding new ways to fight these infections.
Couldn't agree more. This battle against bacteria, it's not over, and we all have a part to play.
Very well said. Thanks for joining us on this Daptomycin deep dive. We hope you found it informative and engaging. Until next time, stay curious.